All right, 6 minutes, 5 minutes and 59 seconds. Woohoo! Exciting. Well, hello, hello, hello. Good night, everybody. Welcome to our very first live stream. If you are hearing me well, go ahead and put in the comments. I can hear you. Just making sure everything is going good. Hopefully, you guys enjoyed the music. That is from Epic Sounds. Epic Sounds is our music provider for tonight. And I see a couple of people that are already in there. Hey, shout out to my sister Natalie. Hey, what's up? And Monica, you're there. And over on this side, helping me out is Maria. So, hey, Maria. She said, I can hear you clearly. Yeah, so good. Welcome. So we are so excited. And I wanted to do this live tonight for a couple of reasons. One, we have been talking about doing it. And today is our 1 year anniversary for this channel, for our YouTube channel. So we wanted to make sure that we did this, make sure that we acknowledge that this was something that was happening. For all of those of you who are subscribing, those of you who are listening, those of you who are commenting, thank you so much. But we are so pumped up tonight because it's been 1 year. You know, a year ago, we talked about doing this channel because there were so many people that were having, issues in COVID. So everybody was locked down, everybody was in their homes, and we thought this would be a good way to get some information out there. And it has been a wonderful year, all the topics, and we're going to go through some of those here in a minute, all the things that we have talked about, all of you that we've interacted with. So thank you for being here. I can't say enough about how excited I am, not just because it's a year, but also we've been talking about doing a live stream. So far, we've been doing some recorded videos, and we thought the live stream would give us an opportunity to interact with those people who are out there who are interested in our content. So thank you for those of you who are here, for being here, and for supporting us. So my sister says, I'm gonna see if I can put her on the. How do I get? There you go. That's Natalie. That's my. Hey, big bro. And then, hey, Monica, how you doing? Glad to see you guys. Awesome. So tonight, what we're gonna do is we're gonna actually go through and we're gonna answer some common questions. We're going to talk a little bit about what we are planning going forward, and get your input so you guys can send your messages. You could send it through the email. You can put it in the comments. If there are things that you want us to cover, that's why we are here. So 1 year in, we're excited about all the things that we've done, but we also want to make sure that we are doing the things that you want us. Some of the things that we want us to talk about. With COVID, we've actually done a few videos talking about COVID, talking about the vaccine, talking about diabetes and COVID, and we thought that everything was kind of getting better, and so now we've got the Delta variant, we've got the Lambda, and recently I heard is it Delta 2 now? But all of those things are happening in our world. And it has actually caused a lot of people to change how they do things, right? So we also did a video on how COVID has changed the world. We'll talk a little bit about that here going forward. But just so much that's going on around us. We continually hear our patients talking. As a matter of fact, I saw a lady recently who was talking about how lonely she was, and we saw her again today, and I gave her a book. So hopefully you're using that book, and it's called My Life Story. The Story of My Life. The Story of My Life, right? So this is the book. See if I could pull it back so you guys can get there you go, Story of My Life. And it's a great book, and it just kind of walks you through putting together your life story. And for her, I think it was a great thing because she was lonely. She was at home. She wasn't having anybody, to spend a lot of time with. And so this was a way for her to kind of connect with her history. And so we love to be able to do that for her. All right. So so what do we want to do? What do we want to do? And why are we doing this? All right. So why another YouTube channel? Why another YouTube channel on health? Why another YouTube channel on diabetes and endocrine things? And the reason for it is that everybody doesn't connect with everybody, right? So we do things differently in Dr. Dwain Woode, Diabetes and Endocrine Wellness Center, and the Lighter Way. We do things differently than other places. And so we think we have a way of talking, a way of explaining, a way of interacting with people that can, our slogan is educating the public for a better you. So we are all about education. We're all about how do we make our lives better, not just endocrine wise, not just as it relates to diabetes, not just as it relates to thyroid or our weight, but how do we make our lives better overall? So as we move forward, one of the really good videos that I did was the one with Dr. Paul Dang, right? Talking about faith and hope in medicine. And I love that video because it goes to show that there are things outside of medicine that are really important to us, or should be really important to us. I was talking to somebody recently, and he was telling me that, when COVID first started, he was very annoyed and upset about COVID. But during COVID, he has been able to spend more time with his family. And that's something because of the hectic life that he had and his job and the things that he did, he wasn't able to do that. And so COVID came along, and COVID provided that pause, right? So that everybody, you took that pause. And hopefully there are some things that you did that are now going to be things that you keep doing. So if you've done something in during COVID-19 that you hadn't done before, right? I want you to put that in the comments. Let us know. What are some things that you did? So we, in our home, one of the things that we had struggled with was having family worship on Friday. And so we are now doing that, and we're very conscientious. We're very deliberate about it, about making sure that we are sitting down and spending some time. Now, we try to get my son to play, but the piano, he doesn't always cooperate. But that's something that we love to do. My wife and I, we're walking now, right? So we're walking. I thought I heard something behind me. We're walking Friday, Saturday, and Sunday mornings, and that's something we do. We spend time together. So that connecting, right? So connecting with people is so important. So yeah. So if you've done something during COVID, go ahead and drop that in the comments and let us know what are some things that you have done. So what are we trying to do? So we're trying to educate. We're trying to educate the public. We are trying to provide a place where people can come and ask questions and get answers that are scientifically based, that are honest and open, right? And that don't, what's the word? It doesn't try to be too high and ivory tower, right? Because I have learned in my own life that the ivory tower does not work, right? So we could think that, everything should be a certain way, and everybody should behave a certain way, and everybody should do all the things that they're supposed to do. And guess what? I'll be the first to tell you, I don't always do the things that I'm supposed to do. And so I want to be frank. I want to be open with people as we're talking about different topics, talking about different disease processes. So that's one thing. The other thing is, we have a brick and mortar, a building, and we have people who come in and they see us in the building. And while it is great, we love taking care of those patients in the office. The question is, how do we expand? How do we give more of our thought process to other people? And so this is a perfect place to do that. And once again, I get to interact with more people than I see in the office, or more additional people, I should say more people, but more people that we see in the office. And so wonderful place for us to sit and talk and chat and so forth. There are a couple of questions that we had that we're going to go through here in just a minute. But that's kind of the idea, right? A place of education. So educating the public for a better you. And we can sit and we can talk about other things, because it's not just the disease, right? Once again, it's not just the disease process that is in play. So people don't always manage their disease, not just because they don't want to, or not because they don't want to, but because there's so many other things that are going on, right? And so here it is that we can spend some time and we can talk to them and do that for you, okay? And I hope you guys liked my music. I was very excited. I had a little timer that I was putting on, and it kept cutting off, so I had to create another one on the fly. But this is one of my favorites right here. Now, Maria, who's helping us out tonight, she's been trying to get me to dance, and so if you guys talk enough, I might get up and just dance for you. I don't know if you want to see that, but hey, we're doing everything tonight. All right? Okay, no. So let's stop the music. Yeah, I'm going crazy. All right. So one of the first questions, why don't we just dive into some of the questions that we may have? Let's see. One of the first ones that we have is, okay, how about this guy right here? I disappeared. No, I don't want that. Let's see. Oh, wow. So I'm gone. You guys can't see me now, huh? Yeah, we don't want that. How about this? Oh, there we go. Okay, I'm back. All right. Work in progress, right? So we're just working. And so here's one that I get all the time. When should I check blood sugar? Before or after a meal? And before I even answer this question, I guess one of the things to talk about is why we manage blood sugars. And blood sugars, people think that diabetes is always a sugar food problem. And our understanding of this is a little skewed, right? So what I want to do is maybe change that thought process a little. So when we think about diabetes is an energy problem. It's an energy problem. And the fact that the body is not able to manage and use energy, okay? So insulin is the mechanism by which the body uses the carbohydrates or the foods that we eat. It takes that and it plugs it into a cell. So for example, I'm sitting in this room, and let's assume that there's blood sugar kind of flowing outside this room, and the blood sugar needs to get into this room, which is the cell. The blood sugar can't get into this room because the door is closed. And in order to open the door, you need a key. And insulin is the key that allows the body to open the door, for instance, to this room, to allow the sugar, which is floating on the outside, to come into the room so that we can do all the things that we need to do in here in the cell. Okay? So that's an analogy. So in the body, blood sugar is floating around. You eat something, right? That gets digested, and the sugar from that, the glucose and fructose and galactose and all those things, and that's a whole nother conversation. Those things are in the blood now, or glucose is floating through the blood, and those sugar molecules have to get into the cell, and the thing that the body uses to get them into the cell is insulin. Insulin allows the body to bring all that stuff into the cell so that you can use it. Okay. And if you're not able to do that, if you're not able to get the insulin into the cell, then the body feels as though it is starving. Right. So that's the basis. That's the premise for all that we do. And anytime we have a high blood sugar, anytime that blood sugar goes up, that high blood sugar causes damage. Let me say that again. Anytime the blood sugar goes up, the blood sugar causes damage. A lot of times I'll hear people say, well, oh, my blood sugar went up and it came down and it came back down. I say, well, how long did it take to come down? Right? So it's not the fact that it came down that is great. It's like, how high did it go? Right? So that high blood sugar actually caused a problem. And if we can prevent it from going as high and staying up as long, then we've achieved what we want to, right? And so the question of when to check the blood sugar is we check the blood sugar usually before a meal. Now, why is that? Because you want to know before the meal, where are we? How are we starting? Because if you check it after the meal, a couple of things that we don't know. One, we may not know how much medication, if you're taking insulin, for example, how much medication should I take for the food that I just ate? The other question is, the blood sugar that I just found, is it a consequence of the food or was it already high? Right? For instance, if you eat a steak and your blood sugar starts out at 100, and afterwards, after you ate the steak, just the steak, nothing else, and that blood sugar is 120, right? So the steak really didn't make a big difference in your blood sugars. But if you ate a bowl of pasta and you started out at 100, and now you check it afterwards and the blood sugar is 300-400, right? So the pasta made something happen. Now, let's assume that you don't check it before and you eat the steak. And now you check it after and the blood sugar is 300. Now you presume that, okay, wow, what's going on with this steak, right? Because the steak is not supposed to do that. It's not supposed to raise the blood sugar so high. So is it a breaded steak? Is it like country fried steak, right? Or, was it a teriyaki, marinated steak? Is there something that's on the steak? And I'm looking a little blurry. I think, let me adjust my camera there a little bit. Let's see, is that better for you guys? There you go, right? So is there something that happened with that steak that caused it to cause my blood sugar to go up so high, right? So that's one question. And let's see, you guys commenting? Let's see, all comments. Let's see what we got. Monica said I'm gonna put this up there for a minute. Let's see if I can get her up along with. Let's see if maybe I can move. Oh, there we go. Right. Monica said I had a baby and learned as I go how to raise him in the new world. Okay, I love that. Okay, so answering the question that we asked earlier about what happened in COVID. So thank you. I like that, Monica. Thank you so much. So I got a question there from Maria. We're going to jump into that in a minute. So checking before gives us a lot of information about the food that we're eating, and it gives us a lot of information about the treatment that we need to do, right? So now notice that before I said treatment with medication, but there are several ways to treat high blood sugars, right? I usually tell people anytime you are anticipating a blood sugar, and let's see if I can get rid of this guy here. Give me just a second, guys. Yeah, there we go. Anytime you are anticipating a blood sugar that is going to be elevated, there's 4 things that you can do, right? So if it's before you ate the meal, right, you can decide not to eat as much, right? Because that's going to help the blood sugar not go as high and not stay as long. That's the first thing. The second thing that you can do is you can exercise, right? And this is exercising in addition to your normal exercise because we're eating some more food. And so we can exercise to get that food or get that blood sugar down. And people, you don't usually think about that because they say, well, hey, exercise Monday, Wednesday, Friday. And I say, okay, that's great. But you ate like chocolate cake or ice cream or the lava cake from one of our local restaurants. I don't know why that comes to mind, but you ate the lava cake. Did you exercise for the lava cake? And the answer is, well, no, I exercised yesterday. Well, yesterday is great, and I love that. We want you to do that. But how about the food you just ate? Okay, so eat less of that food. 2, exercise. Number 3, water, right? So water is a wonderful way of helping to decrease blood sugar. In fact, when patients show up in the hospital and they're in DKA, by diabetic ketoacidosis, or they have elevated blood sugar, non-ketotic hyperglycemia, Hey, Francis Fates. Hey, my aunt is on too. Hi, how are you? I'm gonna put her up there. There we go. So we can drink water. And so when you drink water, it's kind of like Kool-Aid. How many of you guys ever drank Kool-Aid? If you did, just give a thumbs up. Say yeah, Kool-Aid in the chat. When you make Kool-Aid, right? So you take the pack, you open it up, you put it in the pitcher, and you pour water in. Like what happens if you put a little bit of water, right? If you put a little bit of water in the pitcher, that tastes really gritty and concentrated, right? So how do you dilute it? Well, you put some more water in there. And so the water dilutes the Kool-Aid. And so think of your body as that pitcher and the sugar in your body as the Kool-Aid. And as you pour water in, guess what happens to the blood sugar? The level goes down, right? So when patients show up in the hospital, fluids is what we give them, right? That's the first thing. Fluids. That's what we're taught, right? Give them fluids because if we can get some fluids on board, now we're going to eventually have to give insulin, but we've seen blood sugars drop, by hundreds just by fluids alone, right? Because that person is dehydrated. Okay, let's see. What does Maria say? Let's pick one from here. So Maria says, is it safe to take metformin while I am doing intermittent fasting? I grew up being told that before taking meds, you have to eat first. Now, Maria, that is an interesting question, and thank you for it, by the way. Let's move this down over here. Here we go. So there are a couple of things that we've got to talk about, right? And so your question has a lot of interesting information and interesting ideas. So let's talk first about intermittent fasting and what that means. And if you Google, you'll see intermittent fasting all over the internet. There are books that are written about it. I'm sure there's some people sitting somewhere on a conference talking about intermittent fasting right now. All right. So intermittent fasting, the idea is that you give the body a length of time during which you don't put any food in. Okay? So you don't put any food in. And the idea is as you are putting less and less food in, your blood sugars are supposed to go down. And if the blood sugars are going down, then the body makes less insulin. And if the body makes less insulin, then several things happen. You're not as hungry. It's easier for you to lose weight because we think, insulin is a growth factor, and insulin is probably one of the things that causes people not to be able to lose weight. So if we're intermittent fasting, we're not putting energy in the body, then the body has the ability to decrease the sugar, decrease the insulin. When you decrease the insulin, then weight goes down and so forth, right? So that's one of the ideas there. And let's talk a bit about why intermittent fasting works for blood sugar. We just said that because the blood sugars are dropping because you're not putting anything in. But the reason it works for weight is during the time when you're not putting any food in, the body still has to function. And if the body has to function, it needs to get energy from somewhere. And if you're not supplying the energy, where does it get the energy from? Yeah, that's right. It goes and it starts to break down fat. And as it breaks down fat, it begins using those excess stores, and now the weight begins to go down. Okay, so that's the first side. That's intermittent fasting. Metformin is a medication that works in a couple of ways. One, it is supposed to decrease the amount of sugar that's produced in the liver. Right, so the liver is our pantry, right? One of the pantries in your house. So when you put food in, the body takes it, breaks it down, the liver stores some of it, okay? And then when you need it, the liver gives it back to you in the form of, glycogenolysis, and it breaks all that down and turns into sugar, and then the sugar now is floating around, like we mentioned, outside the room. And so metformin, one of the ways it works is by decreasing the amount of sugar that the body produces through the liver. The other thing that it does is it makes your body use insulin more effectively at the muscle, right? Now, one of the things that we don't talk about a lot is the fact that the muscle is such a huge consumer of sugar, right? So the liver is really where a lot of the sugar. Hey, Ashley, and let's see who else is there. Hey, Jeanette Walters. Hi, how are you? So the liver, the muscle is a consumer, and if we can get the muscle to use more sugar, then the sugar decreases, right? So that's how metformin works. Now, one of the side effects of metformin is that metformin can cause some GI disturbances. So for some people, it causes a little queasiness. For some people, it can actually cause diarrhea. We've had some patients who've actually had vomiting. And let me say that metformin has been around for a long time, and we use it all the time. Recently, there's been some things that people have talked about metformin. If you guys would like, we can get into some of that. But to directly answer this question, you can take metformin even though you're doing intermittent fasting. But I would recommend taking the metformin with the food that you eat. Right? Because we tell people if they do that, then the GI side effects are not as pronounced. So that would be the answer to your question. I know that's a long way to go. Thank you for that question, Maria. Let's see. What else do we have? Maria says, hydrate, Kool-Aid. That's right. Let's see. Is metformin safe for the kidneys? Oh, see, Monica's trying to get us into some discussion here, right? Is metformin safe for the kidneys? All right. So there's this idea out there that metformin damages kidneys. Okay, and I'm not sure where that came from. I think it's probably the fact that a lot of times when we see someone who has an elevated creatinine, and the creatinine is a marker of how the kidneys are functioning, right? One of the markers. There's several others, GFR and creatinine clearance and so forth. But the creatinine, when you get your CMP or your BMP, one of the things that your doctor will check is what's called a creatinine. And if you look at the creatinine, the higher it gets, the less or the lower the functioning of the kidney is, right? So it's usually about 1 on average. And we were taught that if you increase it, for every point that you increase it, then the kidney function is going down further and further. Okay, so that's the creatinine. That's how you mark it. And so what happens a lot of times is traditionally, if I have someone who has a creatinine of 1.5 for women, 1.4 for women, 1.5 for men, then I would take those patients off of metformin. And it's not that the metformin damaged the kidneys. It's the fact that the patient's kidneys are not working well, so the metformin stays in the body longer, right? So it's not that the metformin damaged the kidneys. It's the fact that your kidneys are already damaged, and you probably shouldn't be on metformin if it's at a certain level, right? So that's a simple answer, Monica. There's more that we can talk about if people are interested. If you are, go ahead and drop that in the comments. Okay. Hey Yolanda, how are you? Well, let me take this one off of here. Let's see. Is metformin safe for the kidneys? Let's see what Yolanda's asking. Whoa, that's a big one. Let's see if I can get that down. There we go. If a teenager has dark neck, is that a sign of diabetes? Okay, so it's not necessarily a sign of diabetes, Yolanda, but it is a marker of insulin resistance. Okay, so now it turns out that a lot of people who are insulin resistant are diabetic, because diabetes really is an insulin resistant disease. And so what happens is, we said that insulin is a growth factor. That means that insulin makes things grow. And so let's see how to explain this. So if I have two people, right? And one, well, let's take one person. I'll start with one person. Let's say Bob, right? And hopefully none of you are Bob. So Bob starts out, and Bob's 150 pounds. And Bob's body makes about 25 units of insulin, which is typical, right? So it makes about 25 units of insulin a day. And Bob puts on weight. Now Bob is 180 pounds, 190 pounds. His blood sugars still have to remain normal. And so the body begins making more insulin, right, to maintain the blood sugars where they should be. And as Bob puts on more pounds, then the body makes more insulin, and more pounds, more insulin. So actually, if you check a person who has diabetes, and right now we're talking about type 2 diabetes, if you check them early on in their disease, their insulin levels are actually higher than someone who's not diabetic, right? Because the body's having to make more and more and more insulin to compensate for the fact that we're putting on more and more weight. That process causes the body to have all this excess insulin. And we said insulin is a growth factor, and insulin makes things grow. And some of the places that insulin will make things grow is in the folds of the neck, right? It's called acanthosis, acanthosis nigricans, sorry. Right? So the folds of the neck, under the armpits, the elbows, the knuckles, right? So they get thicker. And it's the fact that the skin is now getting thicker that's causing the pigmentation that you see. So it's not necessarily a sign of diabetes, but it is a marker of insulin resistance. And insulin resistance is one of the biggest causes of diabetes. It's a very good question, Yolanda. Thank you for that. Okay. All right. So once again, right, guys, we are celebrating 1 year, and where's my applause? Woo! I don't know if you guys heard that. I got some part. Yeah, there you go. Right. So it's right. So we're celebrating that we've been on YouTube for 1 year. And we appreciate you guys joining us to just kind of talk a little bit and to enjoy what we're doing. So we talked about the fact that we are planning why we did this, right? We wanted to kind of begin educating people outside of the office. We thought it was a good way to connect with more people and to share some of our thoughts and some of our ideas. One of the things that we talk about in our office, and I asked my team, I said, why are we here, right? Why are we doing what we do? And our mission statement says, our practice exists to evaluate, treat, and educate patients with endocrine disorders, right? Evaluate, treat, and educate patients with endocrine disorders. And one of the things that we want to make sure is that we're always educating, because if you get education, if you know how things work, then you can make decisions. I can't tell you the number of times that I have people who are coming into the office who, for some reason, have had a misconception about how something works, either with the diabetes, with their thyroid, with their adrenals, their pituitary, with their testosterone. Some of those are some of the things that we treat. And when we are able to educate them, right, we see that light bulb go on, and they then become able to be an active participant in their care. Other than that, they're not participating. They just wait for the doctor to tell them what to do. And I firmly believe that if we educate patients and we give them enough information, then they're able, right, to make decisions with more information, and they are better partners in their care, because they can tell you, hey doc, I know you told me this thing over here, but when I tried it, this is what happened, or my experience has been this, or this is how my body works. I tell this story all the time. I have a guy who's diabetic, and he eats ice cream, right? And his blood sugars may change, go up maybe 20, 30, 40 points. Okay? But he eats carrots. That's right, carrots, right? Healthy carrots. And his blood sugars go up to 300. All right. So here's a case where his body is responding in a way that we would not normally think. And there's no way to know that sitting in the office, right? So people go out and they live their lives and they bring information back. And so I love being able to sit down and talk with them and use that information in their treatment, right? Because you guys gonna get me on one of my so we are great, and when I say we as a society, as the medical community, we are great at the cookie cutter medicine, right? So the 95% of people who fit into the bell curve, but remember there are those 2.5% on either side that don't fit the bell curve, right? They don't fit the bell curve, and so we want to make sure that we're touching them as well. All right, so let's see. We got some more questions over here. What if the person eats and sleeps a lot? So this is from Yolanda. Okay, let's bring that one up. And so Yolanda, can you give me a little bit more information? You said eats and sleeps a lot. Is that just something new or something that's been going on for a while? And are you asking with respect to suspecting diabetes or some other things, right? Because there are a lot of things that can go on there. All right. So if you can give me a little bit more information, and we can answer that question. All right. Let's see. How about this one? Okay. How do you get diabetes? And thank you, Yolanda, for that. I'm gonna take this off for a minute. Let's go back to me. And Yolanda says, "Congratulations on the anniversary. Thank you so much. We're excited. We're excited about this. So yeah. All right. Let's take that down and let's go back to this one here. So how do you get diabetes? So diabetes can come in lots of different ways, and there are several forms of diabetes. And so I'm going to talk about three of the most common: type 1 diabetes, type 2 diabetes, and gestational diabetes. And let me talk about type 1 first. Type 1 diabetes is a autoimmune genetic disease, we believe. And so we believe that a person has a genetic disposition or predisposition for diabetes. And then something, so there's the genetics that's there, and then something happens subsequent to that that triggers the diabetes, and then a person who's type 1 becomes a diabetic. Now, what's different between type 1 diabetes and type 2 diabetes is that in type 1 diabetes, the cells in the pancreas, right, the beta cells that make insulin, they are destroyed. And so after a while, those cells can no longer produce insulin. And we need insulin to live. It is not possible to live without insulin. That's kind of like trying to live without air. Okay? So those patients need, or we all need insulin to survive. So if the body is no longer making the insulin, then we've got to give insulin. That's why type 1 diabetics, people who live with type 1 diabetic, and that's the phrase we're using now. We used to say type 1 diabetic or type 2 diabetic. And so we're saying now people who are living with type 1 or living with type 2. So people who are living with type 1 diabetes, they require insulin because their body no longer makes it. Okay? And that's how they get it. So they have a genetic predisposition, and then something happens. We believe they get an infection, and the culprit, or the infection that we think they get, is a Coxsackie virus, and it's a cold virus that we get, and we think that hits the cells become inflamed, they begin getting destruction, and then no longer can the body make insulin. So that's type 1. Type 2 diabetes is what we described earlier as an insulin resistant issue, and so we believe that those patients are making more and more and more and more insulin to compensate for the fact that their blood sugars are rising, their weight's going up, and at some point, their body, let's assume that the body's making more and more and more and more, and it gets to 45. And I'm just picking that number. That's not a real number. Let's say it gets to 45, and the body can make 45. It can't make any more, but it's been doing that. It started out at 25, and now it's 20 points higher. That's the most that the body can make. But the person needs 46 units of insulin, right? So the body makes 45, but the person needs 46, and that's the point at which the body, a person begins being a diabetic, okay, or type 2. And then then gestational diabetes is what happens in pregnancy. And we did a video recently on gestational diabetes. If you haven't done so, go ahead and take a look at that. So gestational diabetes, and with gestational diabetes, it is also an insulin resistant issue. And what happens is all the hormones that are changing in the body causes the body to not use the insulin as effectively, and so that person becomes insulin resistant. Okay. All right, let's get back here and let's see, Yolanda. With him there. Congratulations. Hey guys, this is a couple of friends of mine. Nice. Good to see you guys on. All right, let's see. Yolanda, let's put this up here. Yolanda says, ooh, that's a big one, Yolanda. Ooh. Okay, let's see. Let's see if we can bring it down a little bit. And so she says, I have an 11-year-old cousin with dark neck, and she eats a lot. She even wakes at midnight to eat. She also sleeps whenever she's inactive, and she drinks excessive amounts of water. So, Yolanda, and I forgot to say that, we don't intend to give medical advice. So if you are concerned about your particular situation, make sure you contact your medical provider, right? But having said that, let's go ahead and talk about this question. So Yolanda, as I look through this question, I see a lot of signs of possible diabetes, okay? So the dark neck, right? So we talked about that, the increased insulin or insulin resistance. She eats a lot, so polyphagia. So people who are insulin resistant, who are diabetic, what happens, and actually I shouldn't say insulin resistant. So people who are diabetic, remember we talked about the fact that the sugar, which is the energy for the body, can't get into the cells. And so if you can't get into the cells, then the cell thinks it's starving. And what do people do when they think they're starving? They eat. Okay, so polyphagia. I'm going to jump down and say she drinks excessive amounts of water. So once again, if you add to this, if you tell me all of a sudden that she's peeing a lot, guess what? I'm going to say we need to make sure we check her for diabetes. Because what happens is you're drinking a lot of water, right? Because the body's forcing you to drink water, because what happens is the blood sugars are so high that the body begins peeing out the calories. And when you pee out calories, because you're trying to get the blood sugars down, the amount of fluid that you have goes down and you become thirsty, and so you're drinking. And so it's not uncommon to find someone who is diabetic, who is uncontrolled, someone who blood sugars are really high, that they're running to the bathroom. And as they're running to the bathroom to pee, they're grabbing a bottle of water to drink, right? Because they've got to get rid of what's in the bladder, but they're so thirsty that they're drinking. So they're peeing, they're drinking, they're peeing, they're drinking. And if your body thinks that you are starving, if your body is not able to get the energy that it needs, then you're tired, and so you sleep a lot. So acanthosis, polyphagia, fatigue, polydipsia would be the drinking a lot. So I would recommend, Yolanda, that you guys get your cousin looked at by a physician. Okay, good question. Let's see, Ashley. What does Ashley say? So let's pop this one up for let's do it, Ashley. So Ashley says, I had gestational diabetes. Does that mean my baby is at greater risk of developing diabetes? So good question. Look at my little baby. She is so cute. She's so cute. Are you letting her do what she needs to do, Ashley? Okay. Yes. Leave her alone. But gestational diabetes. So women who have gestational diabetes, and once again, it is a partially insulin resistant issue. They are at increased risk for diabetes later on, and their babies are at increased risk for diabetes. And it's not necessarily that they're increased risk for type 1 but increased risk for for type 2 diabetes. So Ashley, to answer your question, yes, both mom and babies of gestational diabetics are at increased risk for that. And I forgot to say that type 2 diabetes also has a genetic factor, right? They also have a genetic factor with it. And the genetics and the environment are the two things that come together to cause diabetes type 2. So, and the incidence of type 2, right, the coincidence of that in families is higher than it is in type 1. Because remember, birds of a feather flock together. People in families tend to eat the same. They eat the same things. They eat the same way. They have the same habits. And so one of the things that we do is we tell patients, hey, make sure that you that you've developed a healthy lifestyle. And if you do that, then that, of course, decreases the chances of diabetes. Oh, and here's Winifred. This is my aunt, guys. Thank you. She says, congratulations. We appreciate that. Thank you for joining us. Okay. And so we continue talking about, the fact that we are excited that we've been here a year. And we, as we're doing this, right, and I'm going to ask some questions here about thyroid in a minute. We are the Diabetes and Endocrine Wellness Center. That's what our practice is, right? But as a channel, as a resource, our plan is not necessarily to confine ourselves to just endocrine issues, because there's so many other issues that we can. And you guys, am I blurry? I look blurry on the camera. I don't know what's going on. Maybe I'm moving too much. Just let me know. Drop me a line. Say, yeah, blurry or no blurry. But yeah, so this resource, we are hoping to not just confine to endocrine issues, because there's so many other things that we talk about. So one of the things that's going on now, and I'm going to hop into or transition into this, and we'll come back and answer some more questions. But the COVID-19, and so I think there is so much misunderstanding of COVID-19. So I wanted to take just a minute to talk about that. And once again, we've done some videos on this. But COVID-19 is the coronavirus that was identified in 2019. That's what 19 means, COVID-19. But the coronavirus has been around for a while, right? In fact, when I was in medical school and way before that, they got books and so forth about the coronavirus. And I won't tell you how we remembered it, the coronavirus. But the coronavirus has been around for a while. This strain of coronavirus, the 2019, is what is different, okay? And I want to talk not necessarily about how the virus itself, but I want to talk about vaccination and what that means. And, those of you who are on, and we have different ideas about vaccination, whether we should get vaccinated, whether we shouldn't get vaccinated. And you guys, we're not going to spend time talking about that particular aspect of it. But I want to talk about what vaccination means and what it does not mean. And so we are encouraging people, the CDC is encouraging people to get vaccinated. And they've adjusted their guidelines. Now we're back to masking in homes or inside buildings and so forth. But when you get vaccinated, the vaccine decreases the complications, potentially decreases the complications you get should you become infected with COVID-19. Notice what I said. It decreases the complications that you potentially have. It makes sure that you're not as sick, to say it plainly. So when you get the vaccine, you potentially don't get it as sick as you would if you didn't have it, right? So that's what the vaccine does. The vaccine does not prevent you from getting the virus. It also doesn't prevent you from passing the virus on to someone else, right? So if you are in an environment, right, say you're vaccinated and you got a friend who's vaccinated, and you get a third friend who's not vaccinated. So the three of you guys are together. If someone comes into your presence, a fourth person, and that person has coronavirus, who can get it? Well, all three, right? All three of the people, the vaccinated ones and the ones who are not vaccinated, can still get coronavirus. And so it is not that if you're vaccinated, it prevents you from getting it. But if you're vaccinated, it helps you from getting as sick. Okay? Okay, Yolanda said it doesn't look blurry, and Maria says clear. Okay. Maybe it's my glasses. How about that? Maybe I clean my glasses. Yeah, so maybe I'll look. Oh yeah, okay. All right. So I'll take your word for it. All right. So that's the coronavirus, right? So should you get vaccinated? Should you not get vaccinated? We won't have that discussion now. If you guys would like, we can have a live stream where we actually talk about that topic. That would be a good one to put in the comments. But remember that you are not prevented from getting it if you're vaccinated. So in my thought, right, I tell people, even if you're vaccinated, right, you should still have a mask on. All right. I know, yeah, okay, I just opened up a can of worms right there, but that's okay. We say you should still wear a mask, right? And if you're going to be in the presence of other people, hey guys, protect yourself. So I've heard people say, well, I got vaccinated, I got it, and I really didn't get that sick. Yeah, so that's what's supposed to happen, right? Now the thing is, you don't know how sick you would have gotten if you hadn't gotten vaccinated, right? So the idea of the vaccine is not that it's a bulletproof entity, but there are things that can still happen going forward. Okay, all right, there we go. Let's see. How about, here's a good one. You guys lost me. Let me put myself back on camera. There you go. And how can I move this back down? Okay. Well, let's do this. I'm gonna put the question up. And then I'll come back. How about that? So I'll get rid of myself. Boom. All right. There's the question. Should I eat keto or following Weight Watchers, or should I follow? I guess is the question that they were asking. Or should I follow Weight Watchers? All right. So I can bring myself back. Okay. So let me start by saying it's a great question. And all diets, and when I talk diet, I'm not talking about. I am talking about a diet, like I am on a diet. And not this is the way I eat, but I'm on a diet for these next 3, 4, 5 months. Okay, and that's one time we'll do that as well. But all diets work. In fact, I'm going to come up with the diet right now. Okay, here's my diet. I am going to go on a bark eating diet. That's right. I just created it. If you guys hear that anywhere, that's mine, right? We just came up with that right now here at this moment. A bark eating diet. And the bark eating diet is, I am going to go outside 3 times a day. I'm going to cut some bark off of the tree in my backyard, and I'm going to eat that along with doing some exercising, getting good rest, drinking water, and so forth. And guess what? Yep, I'm going to lose weight. Oh, yeah. Right? I'm going to lose weight. And we just came up with that diet. So diets work. Diets work if they fit into your routine. If they don't fit into your routine, let's see, who said this? What Monica said. I don't know where you're going to get that food from. Oh, okay. Clear that. I think she was answering something else. Monica, tell me what you're talking about. Okay. Yeah. So if it fits into your routine, then it works. If it doesn't fit into your routine, guess what? It's not going to work. Okay. So with that as a premise, let's talk about keto and Weight Watchers. Both keto and Weight Watchers are decreased calorie diets. Right? So they manage how much you eat, right? So here's and I'm not talking about, we're not going to talk about whether Weight Watchers is good. That's not what we're doing. We're just answering this question. So if you limit the amount of food you eat, you're going to lose weight. And both those diets, and a lot of the diets, all these commercial things that you see, what they do is they help you manage that. Because for me, it's much easier to have somebody else prep my food and just hand it to me and I just eat it, right? And if I am good, if I stay to the diet, if I stay to the plan, if I stay to what they're telling me, and don't after they hand me the little box of food, if I don't then go off and run down the street and buy some Twinkies, some cupcakes, and buy some juice, and then give a hamburger, then I am going to lose weight after that, right? Because someone is managing that to me. It's a decreased calorie. The same thing for keto. The keto diet is decreasing carbs, right? And if you think about all of you who are there, right? If you kind of look in the mirror and you think about, the part of your body that you think you don't like, okay? And for me, I'm just gonna say right here, right down. You guys can't see, but right down here. You know what caused that? It's not the steak. Yep, that's what it is. Yep. Those cookies, the ice cream, the juice, right? Those things that cause there. Because remember, we started out by saying that the body diabetes is an energy problem. Well, most of you may drive a car, and if you drive a car, you put gas in the car. You put gas in the car, and you drive. And until you drive to a point where the gas goes down, you don't put any more gas in the car. Right? The body uses sugar for energy. But we always put more energy into the body before we used up the one that the body, right? Before we use up the one that the body has. And so what happens is every time you eat, if the body still has access to the energy from before, what does it do with the new energy? It stores it. And where does it store it? Well, under here, right? Down here, right? Back here. So all those places, those are things that the body does, and it stores them. So the keto diet, Weight Watchers, all diets work. Okay. All right. So we are, guys, coming up on the top of the hour, 2 minutes away. And I want to thank you guys for coming out and joining us. I see some other questions. Monica, I'm just going to run through these. Let's see. Monica said, the bark diet, where's she going to tell the reps to go for that? Charlene says, thank you for sharing. Thank you for being here, Charlene. Maria says, reps need to be resourceful and creative. LOL. See, Monica, she's trying to get on me. So Cherries Garcia. Next time we talk, you guys ask me about Cherries Garcia. Okay. But once again, thank you guys for being here. Thank you for hanging out with us. We are so excited that you are here. And let me see. I've got a thing here. I'm planning to play. Okay, here we go. And we will be putting up when our next live is going to be. So thank you for being here, all of you guys, for doing. And this guy, we're going to play some music. We dance out together. Okay. All right, guys. Bye-bye.